you go. And just a reminder as well that the recording will be available in the next few days on the BC Lung Foundation Ask the Experts YouTube channel. So if you want to go back and review what we covered today, it will be there. If you don't know us already, I'm Lindsay Wetterstrand, and I am one of your experts that you can ask questions to. I've been a respiratory therapist for a few years now, and I'm happy to say that I am one of the instructors in the respiratory therapy program at Thompson Rivers University in Kamloops. And my partner in crime is the lovely McMillan, excuse me.
So like Lindsay mentioned, my name is Alexa McMillan. I actually graduated with Lindsay. We have been practicing RTs for over 10 years. I am one of the assistant practice leads for the RT program or department here at Royal Inland Hospital in Kamloops. I've worked in a variety of different roles throughout the community, pulmonary rehab, and then in acute care. And Lindsay and I have been doing this now for, I believe, about 3 years. And I'm also the person that will answer your questions if you are on the Better Breathers Facebook page. And if you're not, go ahead and check it out. It is a closed group that you can ask a lot of questions. There's a lot of support on there. And that's where we also post all of these webinars and education going forward. So I'm looking forward to presenting with you today.
And just a reminder, we do have our next month's guest speaker lined up. You may have already seen her. I'll let Alexa explain what the talk is for next month.
Yeah, so next month on April 16th, same time, 10 to 11, we are have the absolute pleasure to have Dr. Emily Brigham in and one of our local respiratory therapists, Jacqueline Turvey. They are going to be doing a really great talk on wildfire smoke and extreme heat. And they're going to present on an action plan. So to give you guys a tool on how to take control of during times of wildfire smoke and extreme heat. So it's going to be a really great talk. Again, that's April 16th from 10 to 11. So you'll be able to register for that shortly in the next couple of weeks, probably after this presentation. So look out for that.
It's actually a really good talk. Dr. Brigham presented last year, and she's been able to employ this action plan over the last year and has just found really good success. And we all know that we're a little drier this year, so it might happen. So without further ado, I'm going to just share what I see, and we will jump into our presentation. So today our focus is not necessarily speaking to the different respiratory medications themselves. That will probably occur later this year in June, where there is a lot of different medications that are available nowadays. But one of the bigger things we wanted to talk about was the importance of understanding the different devices that these respiratory medications come in and understanding the proper techniques and requirements to use them effectively so that you are receiving your medication appropriately and managing your symptoms the best you can. So just a disclaimer that we always love to remind people that your medications will affect every single patient differently. We all have our own different biological makeups. I might be sensitive to something, Alexa is not. So our own bodies and our genetics will impact how a medication works for us. So what works for you medication-wise and device-wise may not work for your friend and vice versa. And unfortunately, there's not kind of one fit for everybody. So it may take time to find the right fit of device and medication for you. So remembering that using the appropriate technique and sticking with it to actually make sure that you're giving it a fair chance is extremely important. I don't want to go into this too much, but these are guidelines that are important for you to be aware of. Your healthcare practitioners, your respirologists, your respiratory therapists, your general practitioner, use the CTS, the Canadian Thoracic Society guidelines to manage your COPD. And so we just wanted to highlight this is how your healthcare professionals will follow a studied and reviewed plan to make sure that the medications are appropriate for you. And dependent upon the severity of your COPD and the number of exacerbations you have, it will dictate what medications they start you on. This is such a good question. I teach my pharmacology students this. Why are most medications for COPD patients inhaled? Well, if we want to target a certain organ, we might as well choose the route that goes straight to that organ, which means inhalation is the most effective. They act directly in the lungs. And the nice thing is that when you target a specific organ and you are able to deliver the medication to that organ, you limit the risk of systemic side effects to that medication if you take it properly. Also, they work faster than orally administered medications. You take a tablet of some sort, has to go through your stomach, metabolize, then make it to your lungs, and it can take longer. So inhalation faster. And as I mentioned, fewer side effects as well. Oops. There, right. So I'll pass this off to Alexa.
Great. So today we're going to spend some time diving into the different devices that are out there so you can make sure that you know about all the devices or the devices. Some of you guys may be using more than one different type that you're using. So just a little fun fact I like to throw out there. Did you know that studies have shown that only 10% of people actually use their puffers correctly? So our goal for this presentation is to give you more tips and tricks and hope that you leave knowing more about the device that you're using and that you understand it more and that hopefully we can improve these studies and that more than 10% will be using their devices correctly going forward. On to the next. So as you start to notice, and what you're going to start to notice as we go through these slides, there's a lot of respiratory devices on the market, and more keep coming. And each of these devices have different requirements. Some of these devices require us to pull meds, while others will spray medications in when we breathe in. The image on the screen that you see shows the different inhalers that are ranked in inspiratory flow, meaning how much we have to breathe in to get that medication. And you'll see devices like your meter dose inhalers, so these ones, and your RespiMat devices, like these ones. They don't require much flow in, that spiratory flow, because it sprays it into the mouth. Then as you start seeing that wheel as it starts to turn, there's different devices that are going to require more of a breath in to get those medications. So you'll start seeing things like your discus, your HandiHaler. You really need to take that big breath in to be able to get that medication. So pulling a medication, usually a dry powder, and we're going to talk about all the different devices, if they're a dry powder or they're a spray. So if they're a dry powder, they usually require a big ability to take that big breath in to get that medication. And not everyone has that ability to do that effectively. So if you're someone that can't take that big breath in, maybe these devices aren't best for you, and that a spray option may be better. Some of these devices, as we go through some of them, require fine dexterity. So some of them require taking a pill and placing a pill inside of them. If you're someone that has arthritis or very shaky hands, these devices might not be the best for you. Or if you have trouble being able to press down, you need to be able to do that to actually get the medication for these devices. And some of these devices require an accessory. So if you use a meter dose inhaler, we're going to be talking about a thing called a spacer. These have, things associated with them, costs. They require cleaning. They take up space. They may be a barrier for people to use them. And if you are not using your spacer, then we're going to talk about how you're not effectively getting those medication. So all these different devices have different requirements to be able to get that medication. So we really want to make sure, is this device that you're using right for your breathing? And is it right for you? On top of all of this, we do also note that medications have costs associated with them. Now, like Lindsay mentioned, your primary care provider is going to try and get you on the right medication as per the CTS guidelines, but they're also going to look at costs. Not every medication is covered under your medical coverage plan. Everyone has different coverage, and whether or not you qualify for something that's called special authority based off of your breathing, sometimes the government or special authority will cover the cost of these medications, but not every single medication is covered. So we also look at, are you going to be able to afford the medication? If it's not the best If you're able to afford it, then maybe we'll look at the next best option. So cost is also a huge barrier because some of these devices cost anywhere from $100 to $200 a month, which we know in times like these, it's just not affordable. So we want to look at, the devices, not only can you use them, but also can you afford them, and are we finding the right one for you? On to the next slide, Lindsay. All right, so let's dive into these different devices. Meter dose inhaler, also referred to as MDIs. Now, the medication is probably one of the most common one on the market. Almost everyone probably that we're speaking to today has probably come across the meter dose inhaler. And there's many different medications ranging from bronchodilators to something called inhaled corticosteroids. But they come into a device called a meter dose inhaler. And what these devices do is they have a propellant inside of them, which help keeps the medication suspended. Just lost my train of thought with that. Okay, so the first time we use this device, we want to make sure that we prime it. So if you hear the word priming, priming just means we're trying to get that medication and the propellant all mixed up. So when you first get this, if you just went to go use it and you sprayed it in your mouth, you'd just be getting mostly all of the propellant and not much of that medication, which isn't really going to do us too good. So the most important thing is we first get this, we have to prime it. So we shake it, and we're going to be wasting 4 away from your mouth. Now we know that it's primed and ready to use. You're also going to do this if you haven't used this device for 2 weeks. You'll also want to shake and prime because after 2 weeks, that propellant is going to settle down, and then you're going to get mostly just the propellant out and the medication sitting on top. So we want to get that medication. Let's make sure we prime it. So priming is the most important thing to do first. The proper technique for using this, again, one of the things that we see is when someone goes to use this, they're told to do 2 puffs. We want to make sure that you're only doing 1 puff at a time. So when you go to use it, you're going to shake it. After it's primed, it's going to be sprayed once. After you go through the steps, which we're going to talk about in the next couple slides, after you take that breath in, we want to make sure that we're holding that for 10 seconds, and then we're going to wait 30 seconds before we do another puff. So a common error is that people will double puff before with each use. How do we tell how many doses are left? So this is such a great question that we get asked often. Unfortunately, not all these devices have a dose counter. The only one out of your meter dose inhalers that have a dose counter is your Advair. And with COPD, we don't tend to have very many patients on Advair. So unfortunately, if you do have your Ventolin or your Atrovent, you're not going to have that dose counter on the back. So it's super important that you keep track of all of your doses, and that includes the ones that you prime. So when you get your device, it's going to tell you that there is however many doses are on here. So you can look on your actual canister. It'll say 200 doses. So you need to keep track. When you prime, you'll go 200 minus 4. Every time you use it, you're going to have to subtract. A nice little tip that we like to give people is if you're using this regularly, you should be able to count out, okay, if I'm doing 2 puffs, 4 times a day, you should be able to figure out when that ends and write it down to let yourself know when you need to go and refill your prescription. It will still spray even after the doses are gone. So that is something to really keep in mind. That propellant will still spray out. And we want to make sure that you're always getting that medication. If your doses are already gone and then you're just getting propellant, you're not going to be help relieving that shortness of breath. And that's what we want these puffers to help do, is help with your symptoms. Okay, on to the next. If you use an MDI, it is recommended to use it with a spacer. And the reason why is the medication is delivered so fast that it sprays out the majority of the medication into our mouths, and we're not getting deep down into the lungs. So here's a good example, a demonstration. If you look at this is the back of your throat, and here's where you would spray. If I were to spray it, the majority of the medication is sitting and hitting the back of my hand right here, which is the back of your throat. We want it deep down into our lungs. So the purpose of the spacer is to increase the distance of when it's sprayed and to allow the medications to stay suspended within this tube to allow you to have enough time to take that slow, deep breath in less will hit the back of your throat and more will get down into your lungs. That is going to require you not to have to use as much. Your symptoms will improve. So that's why it's absolutely recommended to always use with a spacer. And just like I mentioned before, we're going to be doing one puff at a time. So we go to use it, you're going to spray one in, take that breath in, and then blow out. You're going to wait 30 seconds before spraying again. We do not want to see double spraying because that second spray you're getting is going to have mostly propellant in it, and we're not going to have that full dose of that bronchodilator or that inhaled steroid that you're trying to get. On to the next. So as you can see here, there's a demonstration on the left-hand side of how to use your meter dose inhaler. The big things that we went over is just making sure you're priming it for first use, or if it hasn't been used for 14 days. You're only going to puff one dose of medication into the spacer at a time. We're always going to wait 30 seconds before you do that next dose. If you hear that whistle, so all these spacers have little coaching whistles. If you hear a whistle, that's telling you you're taking that breath in. If you're going too fast, you're going to have those molecules hit the back of your throat. We want that slow, deep breath in. And again, it's so important to remember to track those doses if you do not have a dose counter. On to the next. Okay, let's talk a little bit about spacers. I feel a lot of people have these devices. We want to make sure that we're cleaning the spacer. We want to make sure that we're cleaning it appropriately. Everyone's going to have different preference on when they're going to clean it. It's always good to wipe around the mouthpiece frequently to make sure that you're getting any gunk off of it. To wash it though properly, we're just going to pop off any accessory that's on the back. You're going to get hot soapy water. You're just going to rinse or swish it back and forth, rinse it, and then let it air dry. The biggest thing is that we don't want to be scrubbing inside of these chambers because they have anti-static charge, meaning that they're not allowing those molecules when you spray the medication to stick to the inside. Once we start scrubbing in there, you're going to start seeing the medication is going to start sticking to the inside of your chamber, and then you're going to be losing the medication. Mind you, some new chambers that are on the market are designated for the dishwasher. So if you buy a fancy one, some of them can be put in the dishwasher, but I'd just be very careful to read the instructions to make sure that the one that you do have can. If you get these given to you from the hospital or from the community, they are not. They need to be washed and dried. On to the next. Okay, so let's talk about the new MDI that's on the market, and this is called the Aerosphere. Some of you may know about this. I'd say it's been out now for about a year. It's our new triple therapy medication, meaning 3 drugs into one device. The benefit of that, now you don't have multiple different devices that you need to not only know when to take, know how to use, everything. You have 3. So what it is, it's 2 bronchodilators and 1 inhaled steroid in one device. We're seeing more and more as guidelines are coming out that triple therapy is really great for onset of your moderate to severe COPD management, but we'll talk about that another date. So what the Aerosphere device is that it does not require a spacer because of it has what's called Aerosphere technology, where how the molecules are attached, or the medication is attached to these molecules that allow it to go slowly down into our lungs. We don't necessarily need to use it with a spacer. You may have some therapists that still tell you to use it with. It's not, there's no pros or benefit studies have not shown that you're going to get more with a spacer, but sometimes for some people, it's just better technique. They're not having to time that breath in. So as you see, it still sprays out at a fast spray. You still need to take that breath and time it in. If you're someone that has troubles timing your breath with the spray, or you have a hard time pressing down, then a spacer may be a good option for you. But again, it's not recommended to use with it. That's all I want to say with this one. Oh, no, the other thing with this one is that it is used twice a day. So 2 puffs in the morning, 2 puffs at night. Again, a lot of people that use this device say they like that versus having that once a day, because now they're getting the bronchodilation relief at night before going to bed. So again, there's another positive to this one. Yeah, on to the next. So when we look at MDI medications, there's a variety of different ones and different forms of medications that are found in these devices. So just note that if you are using them, to make sure that you're using it with a spacer. On to the next. Recently, I would say within the last year, we have had a lot of environmental considerations and projects looking at how we can better our environment. We do know that MDIs are very high have very high carbon emissions. So they contain a lot of potent greenhouse gases in them, which unfortunately impacts climate change. When we did a recent study there, we saw that about 13% of all greenhouse gas emissions from healthcare do come from our metered dose inhalers. So we're really looking at how we can tackle this within a health authority and some of the things that we can do to improve this, because we do know that the medications that are in these devices are super important at improving our COPD management. So we don't want to say don't use your metered dose inhaler because it's bad for the environment, but there are some things that we can do to reduce greenhouse gases if you do use these devices. One, make sure you use it as directed. So if you use your MDIs as directed, you're only going to need to use that prescribed amount of dose. We're not going to need to prescribe you more and more of them. So that's one of the biggest things, is just make sure you're using as directed so your symptoms are being managed so that we're not needing to use more of them. Track those remaining doses. Make sure that we're not, checking these out too soon when there's still medication in here. So super important so that we're using up our medication, we're just using what we need. The biggest one is 0.3 here. There's more and more pharmacies that are now in our community that are taking these meter dose inhalers back. And what we do is we send them off to be incinerated within all of the health authorities within BC. In a hospital, we return these to pharmacy and they're incinerated, and it drastically reduces the amount of carbon emissions to what you would be comparable to your other ones on the market. So if we can incinerate those, we are going to bring down those carbon emissions. So super important. See if the pharmacy that you get your medication from is doing a program. And if they aren't, let them know, because more and more we are trying to reach out to more and more pharmacies so that they're taking more of these back to be incinerated to improve our emissions. And then lastly, ask your healthcare provider if there's a different lower carbon inhaler on the market for you. There are so many other devices out there besides MDIs that can be swapped out, and they are have less environmental impact.
Perfect. Thanks, Lex. So MDIs, a pretty big topic to talk about. We're going to move into the DPIs, or the dry powder inhalers, that I believe a large majority of medications are now delivered this way. It's right in the name. It's a dry powder that will be in the actual device, which means it's not being delivered to you. It means you have to inhale it. A key thing about that dry powder is that you need to store the device in an environment that is not going to add moisture to it, because if you add moisture to a dry powder in these devices, it clumps and you cannot unclump it. And then unfortunately, the device and the medication is no longer feasible or viable for you. So the bathroom next to the stove in the kitchen are not ideal places, just due to the increased humidity that can be in those environments. So bedside table, somewhere else in the kitchen, away from the stove or the sink. Like I said, this is not delivered to you. It requires any patient taking a dry powder inhaler to inhale the medication, as most of you are probably aware, requiring the patient to be able to actually inhale strongly enough to get the medication. If you are ill, short of breath, or in an exacerbation of your COPD, unfortunately, that will negatively impact your ability to breathe in as strongly as you need to. So potentially it could not be the best device for you if you feel that you cannot inhale strongly enough, okay? When you use these devices, it's important that you clean the mouthpiece. You can clean it every single time after you use it. A dry cloth, not a wet one, because we want to avoid that additional moisture. The first one we'll talk about is the Turbuhaler. You can see that it's in the pictures on the left-hand side of the screen. It's one of our older devices. It's more common to see. These devices do not require the medication inside to be shaken up like the MDI. Thank you, Alexis, got it there for me. And so it is important to not shake it before use, but if you do shake it, what you're hearing is the drying agent. You're not actually hearing medication in there. So it provides a false confirmation that there's something in there and it's not necessarily medication, okay? You'll hold it upright, you will twist the cap off, you'll hear some clicking sounds. There's little kind of fins on the inside of the cap just to clear anything away. You're going to hold it upright, nice. We're going to do a turn. We're going to click it one way and click back. And that click is confirming to you that you have a dose loaded in the device. Okay. After you've loaded the dose, please make sure that you hold the device nice and upright. Take a nice smooth breath in and then exhale away. If you unfortunately exhale into the device, we have humidity in our exhaled breath. We have moisture, so we don't want that to go into the device. So exhale away. Put it inside your mouth, a nice, strong, big breath in as fast as you can. Take the device out of your mouth, hold your breath for a count of 10. While you're doing that, you can put the cap back on the device. And if your medication requires you to rinse and gargle and spit, please do so, okay? The red flag that may appear on your dose counter, which is nice, is the warning that you only have a set number of doses left. So make sure that at that point that you see it, you're reaching out to your pharmacy to get your next prescription filled, okay? These are the medications that you might commonly see in the Turbuhaler device, Bricanyl, Symbicort, or Oxys. The next dry powder device that you will see is the discus. Yet again, this is an old favorite of ours. You do not need to shake it. And there's Alexa's got it there, the purple version. And so once you load the dose, which is just moving that thumb tab forward, you should hear a click. That click is confirming a dose is loaded. Hold the device horizontal, don't tilt it. I always imagine a little scoop that tilts over and you lose the dose if it's not nice and level. Exhale away from the device so you're not putting any moisture into it. Lips on the mouthpiece and a strong inhale in, just like that. And then you can take the device out of your mouth, hold your breath for a count of 10, wipe the mouthpiece with a dry cloth, and then go ahead and close it. If you are taking a medication with an inhaled steroid, yet again, rinse, gargle, and spit. Storage is the same for all of them in a dry place, room temperature. And yet again, it has that red flag. So it is that warning to fill your next prescription. And when it's reading 0, there are no doses left, regardless if you're hearing something rattling around inside. And these are the common medications you might be using yourself or seeing. So Ventolin, Ceravent, or Advair. Okay. I think Advair is very common if you've had a recent exacerbation and you have some swelling or inflammation in the airways. The next dry powder inhaler is the Ellipta, and this is a newisher one, probably the last 5 years. It's very popular, and we're seeing a lot of medications in it. Yet again, you do not need to shake it. When you open the cap, you should hear a click. If you don't hear a click, you're not getting a dose loaded. You can try closing it and opening it again to see if a click has returned. But if it is not clicking, no doses are being loaded, take your device back to the pharmacy and get it replaced because it's not functioning properly. If it is functioning properly, open that lid, it will click, exhale away from the device, lips on the mouthpiece, and then a nice strong breath in, tilt your chin up slightly as you go. And then make sure that your fingers are not blocking the air vents. Hold that breath for a count of 10. There's those air vents there. Hold the breath for a count of 10. Exhale away to the side and then slide your cap closed. The key things with this device is that any of the dry powder devices is that if you drop the device after you've loaded a dose, you've lost that dose. So you will have to go through those initial steps again to reload your dose. Please do not be concerned. You cannot get a double dose with these devices, so that's a nice thing. And with the Ellipta specifically, once you've opened up and you've started using it, the medication within the device will expire after 6 weeks. So even if there are doses left, it is technically expired after that 6 weeks. Take a marker, a Sharpie, write on your device the day that you've opened it so you know when, or you can write the date 6 weeks in advance so you know when that device is no longer good to use. Dry cloth to wipe that mouthpiece again. Don't use water and keep it away from any moisture. These are some of the medications that you can see in Cruise, Brio, Trelegy, which is that triple therapy that we're seeing more and more support of using, Anoro or Arnuity. So you might be on one or two of these.
Okay. All right, let's talk about the Breezhaler. So the Breezhaler, also a dry powder inhaler, like Lindsay mentioned, we want to keep anything that you hear is dry powder, you want to keep away from moisture. However, what makes this device a little bit different than the ones that we were just learning about, where you're having to twist or click to load, is that the Breezhaler devices come in a pill form. So when you use the Breezhaler, you need to insert a capsule into the device and then pierce it. And then that's how you're going to get that powder. The powder is not preloaded when you're clicking or turning. So the one thing with these devices that we really like to make sure that we check for is if you have arthritis or any dexterity issues, shaky, you're unable to really pinch those sides, this device may not be best for you. Unfortunately, I do not have a demo of this one. They're not very popular on the market. They're teeny tiny, they're small. So I find that people, if they're needing to pinch it, if you're having a hard time, you're unable to do that, you can't pierce that pill, you're not going to get the device, so that this one won't be good for you. But for some people, they like it because it is teeny tiny. You can bring it everywhere with you. They don't mind putting the pill in, and so let's go through it. So once the pill is inserted, you're going to close it up, and as you can see on the demo here, you'll take the cap off. You'll drop that teeny tiny pill in. You're going to push both sides. Like all dry powder inhalers, we're going to breathe away from it. You're going to put your lips on. A fast, deep breath in. So think powders, you need to suck that powder in. You're going to hold that breath for 10 seconds and then again, breathe out away from it. You're going to open it up. And the thing with this one is we want to make sure that we've got all that medication in there. If you notice that the capsule still looks like it has some powder in it, you didn't take a deep enough breath in, you need to put that back in. And you want to make sure that you repeat those steps. You'll look at it, take a big breath in, and suck back up and go again. You're going to wipe this down again with just a clean cloth. You want to make sure no water gets in there, and we'll wash our hands because we've touched that pill. Unlike the other ones, we're not asking you to wash your hands because you're not really in contact with the medication on your hands. Whereas this one, you're in contact with the medication, you're putting that pill in and taking it out. And if you touch your face with it, it can have some irritation to the eyes. So we want to make sure that we're washing our hands after use. Okay, on to the next one. So in this device, there's 3 different types of medications or that we see that come in the Breezhaler. We have our Seabree, we have our Actura, and our Inzenair, which is our last one. The Inzenair is of triple therapy. So might see more of that as we see guidelines really pushing for that triple therapy. On to the next. All right, so we talked about our dry powder inhalers. I'm going to switch it up a bit, and we're going to talk a little bit about our soft mist inhaler, our Respimat. So Respimat device, again, newerish on the market within the last 5-ish years. Very, very popular. You don't need to shake this device. Unlike your meter dose inhaler that sprays out, this one doesn't need to be shaked. You do not need to use it with the spacer. It does need to be primed. So think about any one of your devices that spray out, you should be priming this after the cartridge is installed. So we'll talk about that in a second. And just like your meter dose inhaler, you're going to prime it for the first time you use it. And then if you haven't used it for 21 days, we should be priming that again. So a little tip that we like to share, and I'd say most pharmacies do this now. When you do get this for the first time, it's going to come in a box. Your cartridge isn't actually going to be loaded in. And loading the cartridge can be a bit tricky. It requires quite a bit of force. So just ask your pharmacist if they can load it for you, if they don't already. I feel like most pharmacies know that it's a bit tricky and they already do. But if you're finding loading your cartridge is hard for you or they aren't coming loaded, just ask your pharmacist to do it because they can just make sure that it's loaded. Because if you don't quite load it, you're not going to get that medication. You'll be fumbling with it. Okay, on to the next. Okay, like I mentioned, this is called a soft mist inhaler. So as you can see that one picture in the bottom corner there, it mists the medication out versus spraying at a really fast force like the MDI. So the great thing with that is it allows more time for us to take that slow, deep breath in to get it into our lungs. To prime this, all we're doing is once the canister is inserted in there, we are just turning it and you just do a 180, pop this open, and then you're just wasting, just like the MDI, we're wasting away to you. You're going to do that until you start seeing the spray. Then you know it's primed, it's ready to go. That's all I want to say about that. The other thing that I like to teach when using this is the word top, or using the word top, because it kind of reminds you of like how to use this device. Think turn, open, open, and then press. Turn, open, press. That's how you use this device. Once you insert the canister can't be removed. It's going to stay in there. Once all the doses, there's a lovely dose counter on these devices. Once all the doses are used up, you can't actually turn it anymore. It locks, so you won't be able to use this when the medication is done. So I really like that. Once it's empty, it locks. It's good practice to make sure you clean this frequently. We're not as worried about water with this one, so wipe it down. It always is good just to make sure it's just either like really damp or sorry, really a dry cloth or just like slightly damp. And yeah, ask your pharmacist to load up the canister and make your life easier. Okay, on to the next. So these devices are really great. They're on the market. They come in a bunch of different forms. We have CombiVent, which is a 2 bronchodilators in one. We have your Spiriva, which a lot of people have changed over to using them a lot easier than you having to insert a pill. And then your Inspiloto, which is going to be your longer acting bronchodilator too. So some of these are just one medication, some of them are dual medication. So great options out there. Unfortunately, there is none that is triple therapy or has an inhaled steroid, but maybe in the future. Okay, on to the next. Okay, let's talk about Genuair. So Genuair, I don't really feel that this is as a super common, but we do see it once in a while. So I think it was important for us to bring it up. But so I'll just quickly touch on it. So this is another dry powder inhaler. So like all dry powders, we're thinking keep it in a dry area. Let's keep moisture away from it. It's going to have a lovely dose counter on it, so we're not shaking to see if we can hear doses in it. So this device is actually really simple to use. You're just going to take the lid off. You're going to see that it's green. So that means green, ready to go. You're just going to put your mouth over top of it. You'll press down. And when you suck in, you'll know that you got the medication because there's going to be a delivery window that turned from green to red. If you didn't suck in, or if you noticed you didn't press that down to get it green, you didn't load that dose. And if you notice that it doesn't go from green to red, so I didn't take a big enough breath to be able to suck in to get that medication into my lungs. So use that as let's let you know if you're actually getting the medication. Green means the dose is loaded, it's ready to go. Suck back in. Red means you got it. So I like that it has that little training, let you know if you actually got your medication, and that nice dose counter. Once all the medication has been used up, you will not be able to load a dose. So another great thing about this device.
Perfect.
On to next. So this one has only 2 of the medications in it. So it comes either in Duculair or Tirduza. So these are just going to be bronchodilators.
Perfect. And then Alexa already alluded to this when she was talking about the Respimat, but there is a device called the HandiHaler. Spiriva originally came in this device where it did involve you having to use a pill. You had to open up the cap, put the pill in, close the mouthpiece, pierce the pill, only pierce it once. You don't want multiple piercings to cause little pieces of plastic to potentially be inhaled. Spiriva was the medication that came in this device. As Alexa mentioned, you can actually get Spiriva in the Respimat. So if you're currently using the HandiHaler and you are happy with it, that's fine, stay with it. But if you are finding that you do not have that fine motor skill or that dexterity anymore, that you're able to put the pill in and deal with it, you can ask your pharmacist just to switch you over to the different device and potentially just make your life a wee bit easier with it. With the HandiHaler, after touching the pills, you should wash your hands. The Spiriva that comes in the pill form has to be protected from light, so you have those pills in the foil package. It's currently, if you research it, it's going through a redesign. I believe that Boehringer Ingelheim has recognized that, you know, it needs some upgrades. So it's currently being redesigned. I'm excited to see what the new model looks like, to see what changes they've made. It is still available though, if you are using it and you're happy with it. So don't fret, it's still there for you to use. Okay. And whoops, let me just click to the next slide. There we go. So there are some takeaways that we always like to remind people of with this. Number one, most medications that you can have for your lung condition are available in multiple devices. So if the medication you're using is great for you, however, you are struggling with finding a device that is working for you, there might be other options available.
Yeah, and ensure that you can properly take or use the device you have. So we talked a lot about the techniques of how to use them. If you're finding that I'm not doing that or I can't use the device, or if there's just one we talked about, you're like, yeah, that would probably be a lot better fit for me, talk to your primary healthcare provider. Like we mentioned, only 10% of people actually use their devices correctly. And a lot of them has to do with just not the ability to able to take that big breath in, or just not having that dexterity or fine motor ability to do that.
Yeah. A key one that I think Alexa and I, well, it's in blue for a reason and it's bold, but using the proper technique with your device is essential for your treatment to actually work and see if it works. Generally, if you are using the appropriate technique and you're adhering to the way that your healthcare provider prescribed the medication to you, give yourself at least a month of doing it properly and taking it regularly for a medication to be deemed helpful, or perhaps another option should be tried. I think Alexa speaks very strongly to this point as well. So just a reminder, you have to be using it correctly in order for it to actually work, and then give it a good old college try.
Yeah, absolutely. And if they're after a month, if it's not working, then try something else. So what works for you and what works for someone else? You may hear like someone say like, oh, I just love my Respimat. It's the best thing in the market. You should switch it. Everyone has different disease processes, has different abilities to use the medications, these devices. So what works for someone else may not be the best fit for you. So it's just super, super important to make sure that when you're looking at these, look at what works for you. And if it's working great, then we shouldn't change that. If your symptoms are doing or managed, then we found the right device for you.
This next slide is, we're not testing you on it, as I tell my students, but it just highlights and this isn't all of them. There are many other medications you might be on, but there's quite a few medications that are available today for treatment of COPD. So just recognize that there are options for you. And
Yeah, it's just a really great
yeah, of course.
just a great reminder that there's a lot of different devices out there and they continue to come on the market, new devices, new devices. So it's always a good time to like check in and see like if you check in with your physician or whoever your care provider is, like, hey, can we just quickly review to make sure I'm using this properly? I've been using it for a while. It's like driving, we do our driving test, we study for it, and then we pick up those bad habits, and we just want to make sure that you're getting the medication, especially if you're paying for it, or if your medication isn't helping those symptoms. So if you're noticing that your symptoms have changed, it could be due to not using the device properly. So
Perfect.
perfect.
Thank you, everybody. I'm going to unshare my screen and we will open up the floor to questions now.
And I'd also like to say we didn't go over every device really fast because we also didn't have the ability to really go into it. We could speak on this for a very long time. So if there's any device that we went over, you're like, can you just quickly demo that again? Let me know.
Yes. And we recognize that we only have 15 minutes left for questions because this usually is a longer presentation topic wise, but you can either put your questions in the chat box, or you can go ahead and just unmute yourself, say your name, and ask away.
Okay, hi, I'm Selena.
Hi, Selena.
I have both Symbicort and the Breeze Tree or the Aerosphere.
Yeah.
So I get really confused at the end because both of them are meter dosed and they get to that red spot where it's 0. And so my question is, am I done when I get right to the line, a red line? or right to the 0. So I always get confused on that part.
First of all, I just want to confirm, you said that you're on Symbicort
Yep.
and the Respiratory.
Yes.
Okay. So I think the first thing that we need to look at is having your pharmacist and your primary care provider look at why you're on both, because this is a triple therapy. So triple therapy,
Yep.
meaning it has an inhaled corticosteroid and 2 bronchodilators, and then you're also on another steroid with a bronchodilator, which we typically don't. That it seems to be a little bit too much of inhaled steroid and bronchodilator.
So
It's excessive.
The Symbicort is my rescue inhaler.
Gotcha. Okay, so you're using this when you have a flare up. So smart therapy.
Yes.
Okay. Okay, that makes sense. Okay, so question was knowing. First, we'll start with this one, knowing when the dose is done.
Yeah.
So with this one, we say once you start seeing that red flag in the window, so right now mine here, it says 120 doses. When it starts getting down, you'll start seeing the red flags start to appear down below. That should trigger you to say, I should go look at to get my prescription filled. You still have doses left. It just gives you that time to go get that prescription refilled. And then once it's done, once you see full red in the window, it's done.
Okay.
You can still use it, but it's not gonna, you're not gonna get medication. With the registry, it also has a dose counter on it. When you get to the yellow is a warning sign, meaning like, hey, you should go look at getting your prescription refilled. Once it's red, the red is gonna say 0. So once it gets to red, it's done.
It's just done. Like there's no extra in it. Okay. That's what I wanted to know. Thank you.
That's a good question. Alan asked, is the MDI the only inhaler that can be recycled, or is?
Great question. I would love to know more about that too. But from my knowledge, they're mostly focusing on the meter dose inhaler. And what they do is that these can be separated. These are recyclable, so it can be a plastic recycle. I know in hospital we put these in our recycle, and then these go to be incinerated to reduce the carbon emissions. Currently, we aren't taking any of the other devices back to be recycled because they do contain the medication in them. There's no, I guess you could recycle the sleeve into a plastic recycling, but currently these are not. When the dry powder inhalers are landing in our landfill, they have very, very minimal carbon emissions. But I'm curious to know, maybe that's something that I can bring forward. I do sit on the Environmental Sustainability Committee, and maybe that's something that we can look at. So thank you for the suggestion.
Ted, where can we get information on injections that I've seen on the US television?
What type of injections are you referring to, Ted?
Ted, do you want to unmute yourself and give just a little more background to that? There you are.
Yeah, I've seen advertisements where it's being suggested for asthma and COPD, and it's an injection rather than using inhalers.
I've never.
Oh, okay. Oh, I'm hearing some feedback.
From our knowledge, and we are pretty kept up well to date. We work really close with respirologists here in the hospital and attend a lot of webinars. From my knowledge, there is no one-stop injection that will help with COPD or asthma. The only thing I could think of that maybe there may be some confusion is people with asthma or COPD are recommended to get a vaccine called Arexvy to prevent getting RSV. But there's nothing that, to my knowledge, that, and Lindsay and I can take this back to see if there's anything in the works, but there is no active injections that we know of that are there to treat asthma and COPD, just more preventative things like vaccines to help prevent getting certain diseases like RSV, which could be very can provide a lot of or could have a lot of complications for people living with COPD and asthma.
Well, that makes more sense to me.
And we have a great talk on that. You can search that in our previous YouTube webinars called the RSV vaccine. And we had a really great presenter, Dr. Cambo, talk all about the Arexvy vaccine.
Yep. No, that makes much more sense. Okay.
Yeah,
Ted,
I wish it would solve a lot of problems and be financially probably very affordable for people.
Right.
There is an injection. Benralizumab is the generic name of the injection. It is for treatment of asthma or COPD. I don't necessarily know if it's in Canada in the current form because it's just being studied. It is targeted towards asthmatics that are an allergy-induced asthmatic. So the white blood cell that's causing the inflammation in the airways is eosinophils. We're going way deeper than you need to know, but it is indicated in the treatment of COPD if there is an overlap. Just a quick research. But definitely, if there is an injection, if you have a respirologist, ask them about it. If there's a new option available to Canadian patients. And Selena said she takes Nucala for asthma and COPD, which is an injection. So that's usually what it's geared for, is more so the treatment of the inflammation versus management of the daily symptoms.
The symptoms, you're still going to need to use your bronchodilators to manage your symptoms and prevent exacerbation.
Yeah.
Mhm,
Okay,
great question.
Yeah,
Alexa?
really good question. Any other questions?
Yes. Alexa, is there a reason why they don't have counters on all of the puffers?
I know we ask this a lot. A lot of them are just older medications and just the change in device. We as RTs find it very frustrating when there's not dose counters. As you can see, all the newer medications all have dose counters. It's when you look at those older ones, and it's mostly just, I think it's just our MDIs that
Just
don't
the
have it. And like, this
MDIs,
is a
yeah.
very old medication, and it's just to change the technology and develop of it. I don't think
Well,
they really put that in,
some
but
the is it the Advair that has the counter?
yeah,
And I
Yes.
don't see why the salbutamol can't have it too.
I know. Trust me, we
Or Atrovent.
love that.
Yes, Atrovent doesn't have a counter either, and it's
Ventolin and Atrovent are probably one of our most widely used, especially in hospital. It's our probably two of our most popular, and Flovent are most popular ones, and they're the only ones that don't have dose counters on it. And it's very frustrating for staff to know. You can see the complexity of how that would be on the floors, and when people are admitted, being able to figure out, does this device still have medication in it? Yeah, it's very frustrating. It's hard.
And it would also avoid patients that are taking Ventolin or Atrovent to help be a rescue inhaler. And they're like, I've been taking it, I'm not getting any relief because there's no medication left in it because there's no dose counter. So
Because again, you can still get that spray even when the dose is done.
Yeah.
Yeah, I know. I don't have an answer on that, unfortunately. I wish I did.
a very good question. Thank you. And I believe Steph, are we talking to?
Yes.
Yes, thank you so much.
I think they've heard, all the other devices heard that complaint, and that's why any other device you see has a great dose counter.
For sure.
Excuse me.
Any other questions? Werner, I see your hand up.
Can,
Yeah.
Yeah. Can you recycle the Respimats? Or just dump them?
I believe at this point, it's unfortunately in the trash. There's no program as of yet.
No, but
What
I
about
love
the
these
cart-
ideas because I'm going to bring it forward.
What about
Yeah,
the cartridge?
there's-
Because it might still have something in it, because the Respimat thing locks, you can't get any more out of it. But what if there's still something in the cartridge?
Yeah, we can't unfortunately pull, once it's in, you can't actually pull this canister out.
I can.
Well,
It's a lot of force.
are you using pliers?
No,
But-
use a screwdriver to start. You just pry it.
Okay.
The biggest
Then-
thing when
then
it
you-
comes down to the canister, it's not the canister that's actually the thing that's causing the most carbon emissions. It's what's the propellant that's found inside the meter dose inhaler. So it's the propellant, the FCAs that are in there, which keeps the medication suspended, or
Right.
what is actually causing the most carbon emissions. So those aren't found in our Respimat devices. So I don't think that they're as worrisome. When there was a big study that showed each device and how much carbon emissions were given off, these were very, very small. It's just the unfortunate throwing something into the landfill. They give off very low amounts of carbon, whereas I have to pull up the study. Maybe I can pull up we do answer the next question, but it's one of these devices, recycling one of them is more impactful to our environment than biking to work, than like all the recycling that you can think of out there. Like it's so impactful. So I'll dig up something if there's any other questions, and I'll share that because I find it very inspiring to recycle.
I've got an interesting number for you, Lex. The carbon footprint of 1 meter dose inhaler is estimated to be the equivalent of a 290 kilometer car ride. So, oh, there you go. Ted just said my pharmacy takes Respimat and puts them in the recycle bin for burning. Perfect.
So
maybe
it's
your
a newer
pharmacy
thing.
does that.
So the only thing is like not a lot of pharmacies are like we're just kind of rolling this out provincially. So a lot of pharmacies aren't because they're like, I don't have the capacity to do that. Not all pharmacies do in the incineration process. Some pharmacies do, some don't, but they also have those collection bins. So what we're trying to teach them is you're collecting other meds to go for incineration. Can you start collecting these? And it's just getting the awareness going on it. So not all pharmacies do it, but they are starting to all come on board. And it sounds like other pharmacies are taking the other medications, which is so great to hear because what they're doing is when you incinerate it, you neutralize that propellant so that it doesn't go into our atmosphere.
And Carolyn just said that No Frills takes the Respimat for recycling as well,
Love that.
however they
Love
do it.
that.
So these are good things to share and good things to ask your pharmacy for sure. We only have a few more minutes. Are there any questions that we could answer for anyone? Or any tips or tricks you have to share other than a screwdriver to get your canister out? Be careful when you do that. Don't let it slip and hurt yourself.
That's true. Especially if you're on blood thinner.
Yeah. Don't do
Well, then
that.
I'm going to say thank you to everybody for attending. This is always such a successful talk whenever we do it. You get to share tips and tricks. You get to remind yourself how to appropriately take your medication. And that's what we really like to see is when our patients are managing their symptoms the best way they can. So this is step one. So we really appreciate it. Just a reminder, the recording will be up in a few days on the YouTube channel. And then we will see you on April 16th. Just before the holiday, where Dr. Emily Brigham and Jacqueline Turvey, who we love and adore, will be back to talk about extreme heat and wildfire smoke action plans, which is, I think we had a relatively mild year last year, but really good timing for this year. So thank you, everybody. We love seeing your faces.
Next month.
Questions. Yeah, we'll see you next month.
Thank you,
Bye.
ladies.
Thank you.
Thank you.
Thank you.